Hey everyone, thanks so much for joining me on the podcast here today. We have a really cool discussion on data-driven healthcare, really focusing on improving hypertension management through actionable insights. Fresh off National Heart Month, not too far away, and what's it called? AMA often says every month should be Heart Month. So I'm really excited for this conversation today. I'm going to let both of our guests give a quick intro. Luann, we'll start with you, and then we'll kick it over. But just give us that kind of 30 to 60 seconds background on each of you, and then we'll go into our discussion here today.
I'm Luann Kimker. I'm the SVP for Clinical Innovation at Azara Healthcare. I'm a nurse by background, and really my role here is to help organizations be able to use data. My background before this was working with large primary care specialty organizations, really helping them in their practice transformation. And that's a lot about what we're going to talk about today. So I'm jazzed whenever we're talking about data to use change. So I'll hand it over to Sinead.
Thanks so much, Luann. My name is Sinead Forkin-Kelly. I'm the Director of Client Success and Growth Strategies in the Improving Health Outcomes team at the AMA. Also a nurse by background with a lengthy career prior to joining the AMA 7 years ago with the privilege of serving a variety of patient populations across the continuum of care, and now focused predominantly on serving patients with cardiovascular disease to improve their health outcomes.
Well, I'm so excited that we have you two on here. I don't know, it would be a group. It wouldn't be a panel, right? Because I think you need like one more for a panel. It's a good group we have here today. Really what I want to focus on kind of for first segment is why hypertension matters and the AMA's role. So we'll kind of switch the order real quick. So let's start with the big picture. AMA has made chronic disease prevention a priority. Why is hypertension such a critical focus, and what is the AMA doing to address it?
Yeah, so I'm happy to jump in, Jared, and give you a little bit of insights into what we're doing. So yes, you're right. We care deeply about chronic disease prevention. In fact, it is a core strategy for us as we deliver on the mission to promote the art and science of medicine and the betterment of public health. We actually have a team on the mission side of the organization, the health outcomes team, who support physicians, care teams, and the patients that they serve to prevent cardiovascular disease. You may know that cardiovascular disease kills almost 1 million patients in this country every year. So to put that number in perspective, that means that we lose 22 Wrigley Fields full to capacity to cardiovascular disease every year. For those of you outside of Chicago, Wrigley Field is the home of our Cubs. So it's quite a large stadium, and 22 Wrigley Fields full of patients who die of cardiovascular disease every year is pretty significant. We prioritize in particular hypertension because it's the number one modifiable risk factor for heart attack, stroke, dementia, and premature mortality. And if we do nothing else other than get patients' blood pressure to control, we know we can put a dent in that number. So let me describe for you specifically the problem that we see in clinical practice. So there's kind of three main problems. Inaccurate blood pressure measurement, meaning that blood pressure measurements are unreliable and non-representative. There is therapeutic inertia. Most patients actually with uncontrolled hypertension shockingly are suboptimally treated. And non-adherence to treatment, meaning half of patients with hypertension don't take their medications as prescribed. And follow-up for patients with elevated blood pressure is just not occurring. So we see these problems across the board in large health systems, in academic medical centers, in FQHCs, community health centers, really across the board. And so we're focused on trying to offer solutions. So one solution that we have developed over the course of the past couple of years is an easily interpretable, highly intuitive framework to organize evidence and best practice so the care teams can prioritize interventions that are guideline specific. So the AMA MAP framework, when it's applied to hypertension, means measure accurately, obtain accurate and actionable blood pressure measurements to diagnose high blood pressure and assess control, act rapidly to initiate and intensify treatment when indicated using evidence-based treatment protocols, partner with patients to support patient activation, improve adherence to treatment, including the use of home blood pressure monitoring. So we've designed tools, resources, educational content to support teams adopt these evidence-based practices. But most importantly for this discussion, we've created AMA MAP process metrics and reports that align with each component of the framework. These process metrics are a real differentiator. Most healthcare organizations have their finger on the pulse of the blood pressure control rates for their population, but these outcome metrics are lagging. So by making process metrics available to care teams and putting actionable data in their hands, the metrics act as a surveillance system, offering insights into which part of the assessment and management process needs attention. In a highly resource constrained clinical operation, these insights can be very powerful. And our collaboration with Azara has enabled us to reach care teams across the nation, caring for millions of patients with hypertension. And for that, we're extraordinarily grateful.
Thank you so much. We're going to kick it over to Luann now. So Luann, your work at Azara is all about using data to drive better outcomes. So what do you see as the biggest challenges healthcare organizations face when it comes to hypertension management?
I think Sinead really clearly outlined what the challenges are in terms of treating those patients. I think the add-on challenge to that is they don't have the data to tell them how they're doing. So we've been working over the last 8 years with the AMA. We started with a small number of practices and building the very basic measures to be able to do that. The nice part about the AMA is they provide all of that research that goes along with it to show where it's really making a difference. We soon realized that we didn't want to just give this to a small group of practices, but we opened it up to all of our clients. And right now, the good part is that we reach over half of the community health centers across the country. And that means where they were used to just getting claims data or one summary measure that told them how they were performing in their blood pressure control, they now have a lot more information. They can see that for a practice, for a location, for a particular provider or care team, and they can drill down into that data to be able to take action, right? So the provider and the care team have tools, their patient visit planning tool, which they use at the beginning of the day. It identifies the care gaps, or rather the opportunities where they can make a difference that are specific to that patient's hypertension or their other cardiovascular conditions. There are dashboards that summarize key pieces of information. And one of the things that it does is it allows you to look at some of the health-related social needs, as well as other conditions, depression and hypertension, homelessness, or not having enough food to be able to eat properly that would help with your hypertension. Not only do we see their control, how they're treating them, but we can look at where the gaps are in that treatment and where a practice can provide more education and support for the patients and the providers to better manage those conditions. An example of this, we work with both networks and individual practices, and the beauty of a network is you're hitting a large group of people. And so one of our statewide networks actually wanted to improve their hypertension control. And one of the first things that they realized was that they weren't doing repeat blood pressures. So that measuring accurately, that first step, was really missing. And so they created, using and working with the AMA, a program that provided education for their providers and their care teams on how to do that. And then they had the data to show them how they were doing. And with that, they were able to see a 21-point increase in their repeat blood pressure measurement. And that was, when we say 21 points, they really weren't doing it at all. And they also saw the outcome increase where their hypertension control increased by 2.1 points. And while that doesn't seem like a lot over a 7-month period, when you think about it being a network, that's hard work to get that moving. So it was pretty significant.
Thanks so much, Luann. Kicking it back over to Sinead. Once we have accurate data, the next step is acting on it. Many patients with uncontrolled hypertension are actually being undertreated. Why does treatment inertia happen, and how is the AMA addressing it?
Yeah, so there's a lot of foundational reasons for treatment inertia, but let me start with measurements, because I think it's the foundation that we need to have in order for treatment inertia to even be touched. The blood pressure measurement that Luann just mentioned, what we're actually looking for in that measurement is the percentage of patients with an initial high blood pressure that had a confirmatory measurement taken during that visit. Why is that important? Well, it's super important because it helps us rule out patients who might be experiencing white coat hypertension or the white coat effect, meaning they don't actually have high blood pressure normally, other than when they're in the clinical environment. And so it's really important to rule those patients out, because we do not want those patients to be treated, right? That would not be appropriate. Just like you mentioned, we know that most patients with uncontrolled hypertension are suboptimally treated, leaving them at risk for cardiovascular disease. So a really big problem. Accurate blood pressure measurement is the foundation to getting patients to control, because if there's distrust in the measurement readings, prescribers, physicians, nurse practitioners, clinical pharmacists, they'll hesitate to initiate an intensified treatment. So what have we done here? So we've created awareness that there's a huge issue around inaccurate measurement. We do remain committed to making sure that our metrics, resources, educational content available to care teams practicing in the ambulatory environment are available. Like Luann mentioned, our process metrics and reports are they're critical, right? They're critical to ensuring that care teams have access to data to guide them around which area of measurement, which area of the framework, measure accurately, act rapidly, or partner with patients warrants attention. And so the data serve really as the starting point. It's not the end, it's the starting point. So when we think about measurement, low performance, if care teams have low performance, right, there's a lot of things that they need to ask themselves. First of all, are the workflows designed to ensure that a patient can be prepared to have their blood pressure measured? Is the exam room layout conducive to positioning the patient accurately? Is the measurement equipment in good working condition? Are the blood pressure measurement devices validated for clinical accuracy and calibrated according to manufacturer's instructions? Is there a measurement protocol in place that's tailored to the available equipment and the measurement methodology being used? And are the care teams competent and confident in their measurement skills? Have they received training? Have we assessed their skills? Is there retraining in place? So all of these things need to be in place in order for there to be accurate measurement that a prescriber will trust, so that they will initiate or intensify treatment according to guidelines and when indicated. So really, again, measurement across the board is for us to help care teams identify the root cause of the problem, but more importantly, to offer them which best practice is most appropriate to help improve performance quickly. And as Luann mentioned, because of our collaboration over the past several years, we've been able to co-host a series of multidisciplinary care team learning sessions, both directed for the health center audience, but also for the network audience, because to Luann's point, their reach to patients is significant. The feedback that we've received from those learning sessions is overwhelmingly positive, and those recordings are available to every Drive users in Drive. The other thing that we offer, which I think is important for the audience to know, because I think there is not a broad understanding of the diverse offerings of the American Medical Association, but the Improving Health Outcomes team, right, the team that I'm on in the AMA on the mission side, we make ourselves available to collaborate with care teams seeking tailored guidance. So we do this by offering full service, so one-to-one AMA MAP program implementation support. We've demonstrated time and again that we can help care teams achieve at greater than a 10 percentage point improvement in blood pressure control, because we focus on each of the performance metrics and ensuring that prescribers have the support that they need to combat treatment inertia, and to ensure that the measurement team have all of the evidence and the support that they need to accurately measure. And then also to collaborate with patients to ensure that they're invested in their health care. If any listener on the call is seeking additional information about the one-to-one program support that we have, we would definitely encourage them to access our AMA website, and they can connect directly with us from there.
Thank you for that. Yeah, people, and if it's something you want to send me the link, I can put it in the show notes or something if it's easier to have them go direct in the comment section or something like that, right? Kicking it back over to Luann, from your perspective, what does acting rapidly look like in practice, and how do providers use Azara's tools to make better treatment decisions?
So it's interesting, Jared, because I think when we're working with the providers and the care teams, everyone wants to believe that they're providing good care, and no one trusts the data. And so having these process outcomes really gives insight into that. And, the numbers can be difficult to see sometimes, As Sinead mentioned, a lot of it is systematic, right? There's lots of different pieces that impact why those numbers are what they are. But when we can show them that information and they look at their patients and the actual blood pressure readings and the treatment that they're getting, it clicks, right? And we provide them with the tools to then follow the guidelines. Sometimes that shows up as alerts. Sometimes it allows them to see the other factors that are impacting that and then be able to intensify or start pharmacotherapy for those patients. So we're really making that easier for them to be able to do. In the tools, you can actually create a group of patients that you're managing and look at their care effectiveness over time. So how long have I been treating this patient? How much has their blood pressure changed? And has it come into the right or what is considered a control level? And there's lots of factors that impact that. Sorry. We also have a lot of outreach tools. And these outreach tools are automated. So they look at patients who meet certain criteria, let's say who are hypertensive and who are out of control. Make sure that they have an appointment. If they don't, we're going to send them a text message, tell them what to do, get them in for their appointment. It's also a great way to get people to think about joining different programs. When Sinead mentioned home blood pressure monitoring, these are ways that we engage patients. And so the automated tools help to do that and then get them again into the right program for what is needed to improve their health. We're also doing some work as we move forward. Home blood pressure monitoring and using those results can be really challenging, right? It's data from all different places. The beauty of Azara is it can integrate that data and put it to you in an actionable format.
Thank you, Luann, so much. Last question for both of you as we start to wrap up the conversation here. And thank you both for your thoughts on this segment. Kicking it back over to Sinead. So the final piece of the AMA MAP strategy is partnering with patients. So what are some of the biggest barriers to medication adherence, and how can care teams better engage those patients?
Yeah, so there are many challenges around patient engagement. And, as Luann mentioned, one of the critical pieces of information available in drives are those data around social determinants of health, right? So there's no finger pointing here that patients are not fully invested in their care. There is an expectation of the healthcare organizations to try and determine what the barriers are and to solve for those problems as much as possible. When it comes to adherence to treatment, I think that there's some misconceptions around side effects of medication that need to be addressed. There are also strategies that can be put in place from the prescriber standpoint to use single pill combination therapy instead of two pills. Every patient is going to want to take one pill as opposed to two if that option is available to them. There is a lack of frequent follow-up with patients who are not at control. So there's a lot of work to be done. Lastly, I will say there is a real movement to ensure that patients have the capability and the capacity to measure their blood pressure at home. We have developed the validated device listing, the first device listing in the US. I'll give you the link, Jared. You can share it with the listeners. In that validated device listing, we have listed those home blood pressure monitoring devices that have been independently validated for clinical accuracy. So if an organization is trying to determine which devices to purchase, or a patient is determining which device might be most appropriate for them, we would highly encourage them to select a device from that list so that we can ensure that they're validated for clinical accuracy.
Last question over to Luann, and then we'll wrap up here. Thank you so much, Sinead. You work with a lot of care teams who are trying to get patients more engaged. What strategies have you seen work, especially when it comes to using technology?
I would say that the automated outreach is the primary way to do that. And more importantly than that, though, is showing the patients that you're using the data that they're providing. If we gather a bunch of data from them, but we don't use it, it's not meaningful for them, right? But when they can when they can see that we know that they're overdue for something, or that they they should be seeking care. We contact them. They outreach to us. We follow up. We get them in. And then we do the right things when they're sitting in front of us. Nothing is worse than leaving an appointment and thinking, well, why didn't my provider talk to me about these medications? And they prescribe a new medication. When we look at some of the measures, the outcomes, we're looking for a follow-up appointment, right? So we want to make sure that the patients who were just seen with hypertension started on a new med, get an appointment scheduled, and come back in to get their blood pressure checked, or have home blood pressure monitoring to make it easier for them not to take off work, to be able to manage their care and and see improvement.
What I want, like, we could talk about this like so much more too. So definitely, like, both of you, if you have resources, like, let's attach it. So let's continue the conversation in the comment section for folks, because I think the resources that you've provided and both of what you're working on is super important, and we should point people towards that way, if it aligns. But I want to thank you so much for joining me here today, in talking about this kind of various segments. But we'll stay in touch, and hopefully we can have you come on again in the future. And let's definitely continue the conversation in the comment section. So if anyone listening wants to find out more, there will be some links to follow. Thank you both.
Great. Thank you.
Thank you.